What's going on, guys? Welcome back to the Fitness for Life podcast. I'm your host, Jackson Lohr, and today I have the pleasure of having with me Noel Capuno coming to us from the Westchester area of New York, from New York Medical College, where he's soon to be Dr. Noel Capuno, DPT. So, Noel, thank you for joining me today. Super excited for you. Excited for this conversation, man.
Yeah. I'm happy to be here. I was excited about the opportunity, and I'm ready to get started.
So let's dive in. Let's dive right in. The thing that I think is really cool is that you and I kind of share, and when you message me, you use the same words that I think of when I tell people my story. So using those words like bridging the gap between rehab and training. And so that is something I'm very passionate about. That's something I know you're very passionate about. In order to kind of get to that, talk to me a little bit about your story of how you got into into the fitness side of things, and also like how you got to where you're at with, becoming a physical therapist and what led you to that.
Yeah. So I knew I always wanted to go into the healthcare field. I started playing basketball at a young age, going into high school, and playing basketball and going into the medical field. PT was a way to kind of connect that too. Um, After high school, I knew MBA was not for me, so I decided to go the healthcare
Yeah.
route, apply to PT school, and go from there. There, I kind of dove into typical going into the gym, working on bodybuilding, weightlifting, Olympic lifts. And then where my passion really kind of grew was in PT school, where I was working with a lot of guys who had the same passion as me in fitness. And then from there, I was able to work at a small fitness studio close to my school, where I was able to work with a wide range of populations, kind of just dipping my feet into the field. And then from there, once I gained my confidence, I started to find a way um, to connect and train people while still having a busy schedule. So I decided to go into the online platform, which was best for me, just being in the Westchester area where most of the people I know are in more of the city, Queens area. Um, so the online platform was a way for me to work with other people in different
Yeah.
locations. And it started off a little bit slow. And then once it kind of get my feet wet, got first couple of clients, and then it just started
Nice.
rolling, and that's pretty much where I'm at right now.
Cool. Awesome. Well, thank you for sharing that, man. I know a lot of people, ath- being an athlete in high school tends to lend itself towards, more activity afterwards, but it's not always the case. And the reason I always ask that question at the beginning is like, I think it's good for people to see, like, hey, not everyone just went to school for, strength and conditioning or exercise science right off the gate. It's, a lot of different pathways. So recently had Andrew Coates on the podcast, and his story is very interesting. He got into it very late in life, but is a big, figure in the fitness industry now. But he'll tell you all about the different stuff that he did leading into it. But today you and I were talking beforehand. Want to get into the topic of pain, and I think it's good. I think a good place to start would just be like, okay, pain is kind of an inevitability. Like, everybody's going to experience it in some way, shape, or form. You and I, my background is I was an athletic trainer first, so I was doing, rehab with athletes, before I got into the fitness realm. And that kind of, like I said before, that kind of got me passionate about, hey, there is a gap, right, between what people can do in terms of, or what people do, not what they can do, but what they do in terms of rehab, post surgery, post, injury, whatever it be, and training, right, and how they train. And sometimes, on the athlete side of it, I see like, oh, people go a lot of times if they don't have a really excellent physical therapist, and coverage that allows them to continue their work, they're not able to make that transition smoothly, right? It's oh, I did really great at my rehab and my passing tests, but now I I can't perform like I want to. So talk to me about like what it is that um, you know you really have found focus on, or have focused on within that gap, and what you would like to see improve and how you would like to kind of step into that.
100%. I basically agree of what you're saying. I feel like the thing that's missing between PT and training, that's why I pretty much got into strength and
Yeah.
conditioning. And then from there, I continue to see the difference and how many physical therapy places didn't really transition a person fully to a
Hmm.
sport. So I would say they're very great with pain modulation, in the early stages of an injury, building up some general strength in order for a person to pretty much be, I say like 60, 70%. But there's this gap where someone's coming out of PT 60, 70%, and you go into your sport 100%. There's that gap that is like missing in between, and which leads to an athlete, a client, like whoever it is, coming back, possibly re-injuring or having a different injury. That's why I really want to talk about bridging the gap of PT and strength and conditioning, because I feel like they're so intertwined. And once we find a way to bridge that gap between PT and training, I feel like athletes, clients, patients, wherever their goal may be, they're going to be better off longevity wise. And I feel like that's going to be the most important goal is not the short term relief, but what we want to get down the line, in the
Yeah.
future.
Yeah, absolutely. And I think that that's something that, for it to have an effect over, the the nation, the world, worldwide, that does take a lot of work, and it takes, I think, interdisciplinary collaboration, right? You're going to have a foot in two
Mm-hmm.
worlds, as many people do within the field of fitness, right? A lot of physical therapists, have a foot in both worlds, the performance and um, the therapy side of things. And so, yeah, I think it's people stepping across both lines, and also collaborating with people like chiropractors, collaborating with orthopedic surgeons, and working with all the people who are going to be involved in someone's process, getting from injury, surgery, whatever it is, to performing well, and even moving them in the direction of optimal, right? I don't like to say performing optimally, or even living optimally, because most of my clients are 55 plus at this point. They're I work with primarily women over in their 50s and above, and so they wouldn't use the term performing necessarily, but moving well, right, and living well. um but yeah, so let's dive into pain a little bit more. um talk talk to me a little bit, if I'm someone who's just trying to understand pain better. Talk to me a little bit about like, hey, is what are the complexities of pain? Like, why do I feel it one day and not feel it another, versus like, we can even at this point get into like acute versus chronic injury and the difference between the two. So I think it's important to understand like how those two work, and yeah, just understanding like where does pain come from. And I know,
I feel like,
sorry, I'm going to interrupt you one more time. I know that
mhm,
this is a topic we could probably spend like 5 hours on. So let's yeah, do your best to summarize in a way that's concise here.
yeah, I'm trying my best. Okay. Um, so the thing is with pain, it's so weird. It really is a weird thing. Um, Of course, you get the typical, oh, I sprained my ankle. You'll have pain for a couple of days, and it starts to lower a little bit. Um, but the thing is, when it comes to people who are dealing with chronic pain, like back pain for many
Yeah.
years, there's a lot of different factors that are playing a role into someone's pain. So what I like to think about is the
Okay.
biopsychosocial model. So you think about you think about biological, the human body, the ligaments and what is healing, and then you think about the psychological part and possible stressors that might be causing pain. Because sometimes, say, a patient or a client might have a lot more pain one week compared to the other. They may feel like they're regressing, and that is leading to possible stress that could be increasing their pain levels. So, with that, I feel like it's important to talk about and especially educate and kind of find those stressors that are leading to those pain because sometimes they don't realize it. Sometimes a lot of people don't realize what's causing their pain or if they've been having maybe a rough day at work or maybe a rough day at school, all of that plays a factor into how your pain may present. Because sometimes your body just tricks you and wants you to be in pain. That's why us as PTs, we try to educate as much as we can to kind of put the person in the front seat rather than the back seat of the car.
Yeah. Yeah, that's a good breakdown. And I think, one of the things I feel like I go over with clients all the time is like, hey, all right, if you had pain today and, say you did the exact same thing like last week and you were feeling fine, that doesn't automatically mean you have an injury, right? It doesn't mean you have something that we need to fix right now. If it was severe, obviously, go get that checked out by a medical professional. And if it was severe, and I think the key there is also lasting, or if other things are feeling out of whack, you want to make sure you get those things checked out. But if say I'll use joint pain as when I'm referring to pain here. I'm gonna go with joint pain, because that's primarily what we're talking about. Is back pain, knee pain, hip pain, that sort of thing. And so one of the things there's a couple of things that I find myself telling clients all the time is like, hey, it might just be that maybe one of the questions I'll ask is, hey, how much water did you drink today? Because you might have drank way more water that day last week and now you didn't, and now your joints aren't lubricated properly because your body doesn't have the water it needs, the fluids it needs. So your joints just have a little extra friction in them because there's not enough fluid in them. Sometimes that happens. That's okay. Or even, same thing can happen with the muscles. Our body's mostly water, and we want to make sure we're supplying it with the things it needs. So that's one thing I often find myself breaking down with clients, like, hey, that water intake can actually have a pretty big impact on you. And I think another thing that's um, it's under recognized is sleep, right? The effect of sleep on your pain levels or just your general like discomfort levels throughout the day are incredible. I remember, so a couple weeks ago I was coming back from a wedding in Boston, and I had to stay up for like 28 hours straight to um to get home, because of the timing of the wedding and the flight, and yeah, just all kinds of things involved with that. But on the drive home from the airport, I was aching all over because my body was like, hey, you haven't slept in a long time. And that was my body's signal to like tell me, hey, you should go to sleep. And so I've been in the car, in the plane, and back and forth. And so that stuff really wears on you as well. And so it doesn't just have to be, something wrong with your muscles or your joints. It can just be your routine. Like you said, stressors is something that we want to keep an eye on, and definitely want to, you know, make sure that we're keeping in check. So, do you have anything else to throw into kind of breakdown of pain. I think I like how you talked about, because your acute injury, something like an ankle sprain, or you know, if you were to do something, pull something, that's going to happen really quickly, and then you know the mechanism because you felt it, right? But
Yeah, just one more thing I wanted to add, just so people know, it's like pain kind of comes in waves. But as long as it's kind of like it's in a wave that's ascending, and you know it's
mm,
getting better. There's always gonna be peaks and valleys, you know. But as long as you know functionally, or you're able to do a lot more and handle a lot more, you're going on the right track,
yeah,
you know.
yeah, yeah, that's a good point. I think our body doesn't tend to be static in anything we do, right? Whether that's weight loss, whether that's muscle gain, whether that's strength gain. Pain is a great example. Like our body does not, nothing just goes like this. It's a lot of waves. So I think that's a good thing to include in there. Now, for those listening, you may have heard me say this once before. Um, I think it's really important for everybody to have a framework for how to go about training with pain, because that's something that's really important, is understanding, like, okay, pain is inevitable, pain is going to be a part of life, so we have to figure out how to move around it, right? And I just made a video this morning, posted on Facebook, and this is, as of recording, we are Friday, May 3rd. So I posted this on Facebook where I talked about leaning into pain a little bit. Because sometimes, especially if it's, muscle or just some light, joint pain, um, the way I like to say it is like, hey, if you lean into that pain a little bit and train through it, a lot of times you'll come out feeling much better. Now, this is when I'm talking about like low level pain, joint and muscle related, not, you know, organ related or really intense pain. Those are the things you do want to rest from. Um, but that being said, like my client model that I like to have people follow when they're training with me online, because I'm not there to watch them and assist them, is basically what I call the light system, right? So you have your green lights, no pain, do all those exercises, go for it. Yellow lights are basically, so the way I frame it, anywhere from a 0 to 4 out of 10 on a 0 to 10 pain scale, um, that don't have throbbing, aching, or sharp pains associated with those movements. Those exercises are going to be a yellow light. All right. And those can change from day to day, right? Something that's a yellow light today can be a red light tomorrow or a green light tomorrow. So you do have to go in with a fresh mindset each day. And I have people kind of rate these and like, hey, if this is a yellow light, we probably want to do them because it's probably going to help us improve, as long as it's not becoming a red light consistently, right? But what we want to do is we want to slow it down, decrease the weight if we need to, decrease reps if we need to, and maybe add some assistance if we need to. So increase the stability of the exercise, whether that's finding something where we can hold on with our hands, or supporting our back, whatever it is that is going to provide a little bit extra stability to the exercise. That may be a useful technique. And then obviously the next progression is going to be your red lights. And those are the exercises we want to avoid that cause aching, throbbing, sharp pains, or anything above like a 5 out of 10. And what I tell people is also like, hey, and those listening, feel free to use this, but also if something is consistent and painful and you haven't already gotten it checked by a medical professional, please do that. So what we're giving on this podcast is not explicit medical advice. Okay. This is a good framework for training. So we're going to keep it training focused. But if you do that, the key to understand that framework for me is, you have to recognize where your baseline is at, right? This is moving up from your baseline, not, okay, I'm in tons of pain. Now I'm going to go do this exercise and I'm in more pain. That's not what we want. We want you to recognize like, okay, this is like what normal feels like for me. Let me, move from that point. So Noel, I know that was a little long-winded, but I'd love to hear kind of like how you work with, especially those that you work with online, what your framework for training with pain is, and what that looks like for you.
Yeah, it's funny because I actually use the same
Oh,
analogy.
nice.
So I actually use the same analogy, and it's very similar, actually pretty like pretty spot on from what
Awesome.
you do. Especially going into the online platform, I feel like that's the best way to do it. Everyone knows what a traffic
Yeah,
light is, so that definitely helps. So what I basically do, same thing with the green light. It means you're good to go. There's no pain with any of the movements. When we start to go into the yellow light, what I like to look at is if you typically may have pain during the exercise, but if you like once you finish the exercise and take a little rest, if the pain goes away, then I still think you're still in that yellow
that's a good
light
point.
and still
Yeah,
good to go. Um, just to monitor that, and then you talked about um, the traffic light changing possibly the next day, which I really like. I think because you could feel amazing, you could be in the green and yellow in the training day. Following day, you feel like it's red. So kind of just being aware of your body and especially the following day and monitoring the symptoms 1 to 2 days
yeah,
after. And if you know that that is where you're starting to feel the pain, so that's you should try to take it back a notch a little bit. Kind of what you were talking about, maybe use an assisted exercise, decrease the volume, decrease the load. Um, that was a good concept. And then just going into the red light is just like pain continues to get worse. You find nothing makes it feel better. That's when we start to hold it back a little bit. Maybe we're doing something wrong. Maybe it's a movement that your body's not ready for, and it's something that we have to tailor a little bit.
right. Yeah, that's funny that that we use the same framework. I know I stole it from someone, or I we share stuff in the fitness industry all the time. But I know I stole it from someone. I'm not sure who to give credit to, because I'm sure somebody came up with that long before I did, or long before whoever I stole it from did. So that is funny to hear that you use that. Do you know where you got it?
Yeah, I learned it. Yeah, I learned it actually in a PT course. I don't know if you heard of the McKenzie
Yeah.
course. It's specifically for
Yep.
lower back, the neck pain. That's where I first heard
Okay.
about the red light,
All
green
right.
light. And then now I've seen it all over the
Mm,
internet. A lot of people are
yeah.
using it now. So I thought I was like, oh, it's crazy.
Yeah. So it'd be interesting to know if Dr. McKenzie actually originated that or came up with that himself. Um,
Yeah, I
yeah.
don't know.
Yeah, because I've read plenty of his stuff. I've never taken the course specifically, but read plenty of that
Mhm.
stuff, which is really helpful, especially in understanding back pain. So and spine health. Um, cool. Um, well, okay. So training with injury is another thing, right? So we've kind of talked through training with pain. Let's talk through training with injury because that's a different thing entirely. And I think you know one of the things that I really appreciate is that there's more and more these days on like the benefits of cross training, and more people are open to like, hey, just because, and there's still a hurdle to get across that especially general physicians. I have this problem all the time. Working with some clients, and their general practitioner will say like, "Hey, you just had this injury or this inflammation. Don't do anything." And I'm like, "Hmm, that that's rough because now they're probably only going to get worse." Especially, I've had and this is very recent. I've had a client who came to me and said, "Hey, I was just sitting and my back felt like it exploded," and I'm like, okay. And then your doctor wants you to do the same thing that happened that, more of the same thing to, you know, help you heal from that. So let's talk through that a little bit, and talk about like, hey, training into some of that discomfort, but also like, you know, how would you address someone who comes to you and says, hey, I got hurt, you know, this is, you know, what I'm dealing with. Can we do anything about it?
Yeah, it's funny because I actually have two clients now that both sprained their ankles
Oh
on the
wow.
same day. Both know each other, both friends, both sprained their ankle, and one was a little bit more severe than the other. But my biggest thing is, um, of course, you want to let everything heal. You want to let the ligaments, you want to let the tendons heal. Um, but my first thing is try to find a starting point for that person. Um, Whether it's an ankle sprain, maybe seeing if they could put a little bit of weight onto it and then shifting back. A little bit of weight onto it and shifting back. For me, it's just I want to slowly progress them into a way that is safe, but is not making the any of the not impeding any of
Yeah.
the healing processes. Um, so I have them immediately starting put depending on how bad the symptoms are, I would have them immediately put their foot down, start putting some weight on it, come right back, and then we'll have the red light, green light. You want to stay in the beginning stages. You want to stay in that green side, of course. See how you feel the next day, but the biggest thing for me is like I would just keep it moving,
Mm-hmm.
try to get some ankle pumps in, move that ankle around, try to move because sometimes movement
Yeah.
is medicine, and continue to get blood flow will improve the healing process. As long as we're not overdoing it and you're not overstepping, um, there's a lot to it. So I'm not recommending to go out there and just if you sprain your ankle, immediately step on your go single leg balancing on your one foot. But you know, kind of be
Yeah.
smart with it. Um, but the biggest thing is kind of what you were talking about. I feel like don't be stagnant. You could still work with the muscles around it. There's still a
Mm-hmm.
lot you can do. You know, so we could keep working through an injury, but just make sure
Yeah.
we're doing it
Yeah,
safely.
and I think I mentioned, you know, the term cross training earlier, but I think it's important for listeners to understand what that is, you know, because you and I can say it, or somebody working in the industry can say it, but if you don't know what that means, it doesn't mean anything. So cross training has been shown to be incredibly beneficial for anyone who's injured or who's undergone surgery. And this is actually something when I had hand surgery about a year ago, actually exactly a year ago today. That's crazy. I to repair some tendons I stupidly sliced through. Um, you know, I had to do a lot of cross training to, you know, improve that. And you can still see the crooked finger here. Um, but I noticed that as I talk with my hands. But what that means is basically, all right. So if my left hand was the hand that was hurt, my right hand on my right hand, I'm gonna mimic the movements that I want, right? So I'm gonna really work through this range of motion, um, and as a result, my brain does this crazy thing where even if I'm not actively training through the same range of motion or the same strength, like if I work on my grip strength here, this gets better, right? And there's all kinds of research out there to prove that's true. And I might even pop some of that in the show notes here for those listening. Um, and so that's something that I think is missed a lot of times when it comes to you know, training through an injury. It's like, hey, we can train the other side, and we can train your cardio, right? In whether it's your upper body that's hurt, your lower body. Now, obviously, if you have full body injury, right, a spinal injury or something like that, you can't quite do that. That's understandable. But if it's, you know, isolated, and it's down to one thing, like, hey, you can cross train, you can train your cardio, and both of those things are things that are going to improve the injured and affected area. So I think it's important for people to understand, like, you can do that safely without the assistance of, you know, someone like us. and it's still going to have benefits. So, yeah. Well, we are, yeah,
Yeah.
we're coming up on around where we want to be time wise, Noel. You know, for the sake of anyone listening, is there anything we missed that you're like, oh, it would be really good for people to hear this about pain?
No, I feel like we
Yeah.
hit a lot of the good points. Again, it's like I think the biggest takeaway is when you're starting to feel pain, I feel like don't think of it as
Mm,
you're not getting better. I mean, there's certain circumstances, but again, like with the peaks and valleys, there's going to be ups and
yeah.
downs when it comes to pain, you know, and having someone to guide you, whether it's a coach, whether it's a physical therapist, it's important to kind of bridge that
Yeah.
gap, like what we were saying, and, continue. I'll continue just training. I feel like
Yeah.
just continue getting better.
Um, with that said, I do want to, I think that's a great point. I think, I do want to use this client example, just for people to really be able to put that like in perspective. Because so I have a client who's worked with me almost 2 years now. And she started out and her pain was, um, you know, daily, like for all day, every day, and at a pretty decently high level. And now she's many surgeries deep. Someone who's had, you know, about every lower body surgery you can imagine, in terms of her extremities and orthopedic, um, yeah, just things that have gone on. But that being said, I started working with her about 2 years ago, and a comment she made to me recently was the pain doesn't last like it used to. It doesn't last all day. Um, and even when I do have flare ups, right? Flare ups are normal. We talk about things going up and down. And if you're training, you're going to push yourself to a point where, you know, you might find that point where you cause a little bit more pain than you meant to. That's okay. You just adapt accordingly. But her comment was when I have flare ups, instead of being on, um, anti-inflammatories for a week or more, now it's 1 or 2 days, right? And so for her, like that is progress, right? That is, she can recognize that, you know, even when flare-ups occur, it's not a setback. But she can, the only way she does that is she zooms out and she says, okay, on the whole, this is what it used to look like for, you know, years and months. Now my years and months look like this. And so she's able to zoom out. And so I think that last piece is really important, being able to zoom out and not just say, okay, each new day that I have pain is a setback. No, not necessarily. It's how your body responds to it, right? Are you more resilient
Mhm.
to when pain or inflammation, um, is present in your body? So, uh, fantastic point. I wanted to
Mhm.
give that point to illustrate that. But Noel, where can people find you if they're looking for you, man?
All right. You guys can find me on Instagram. On my Instagram is no cap fitness with three S's because
Nice.
two S's were taken. So,
Cool.
yeah,
And I'm gonna put you on the spot here. Plans after, next month when you, or at the end of this month when you graduate?
yeah. I actually have a
Nice.
job lined up. Gonna work in a place in
Okay.
Yonkers. Um, and then just continuing to, I think, just run with no cap fitness. While I'm as PTs as a trainer, kind of
Cool.
just bridging.
Awesome, man. Well, super excited for you. That's gonna be awesome. I know you're gonna crush it. And thank you guys for listening. We will see you guys next time.